What's up, y'all? So today I just want to go over a rapid response. Rapid response is a response that is going to a patient's room, or the patient can be in a CAT scan, the scanner, the MRI machine, in the ED. This is where a patient is becoming unresponsive or having some type of problem that the staff nurses cannot handle. For example, this morning I was at the big hospital. Y'all know, the ones that follow me, what the big hospital is. This is a hospital that's the larger trauma center, and I came over because on the weekend we don't have anyone covering the smaller hospital. So I was the chosen one that had to cover. Oh, my lipstick is horrendous. I was the chosen one that had to come over to the smaller hospital, which is like more elective surgeries. We do have an emergency department at this hospital, which if you do come here and you have some type of trauma, we can transfer you to the larger hospital. But soon as I walk through the door, y'all, rapid response, and it's my patient. So when a rapid response is called, this is different from a code because it's less people that come. The code team doesn't come. You have like a person from hospital medicine or internal medicine that responds. The primary care team responds. You have the nurse. Then you have like a stat RN. The phlebotomists come. I showed up on the scene first, before the internal or hospital medicine responded. So I first assessed the patient to see what the neuro status is because the patient was here for neurological services. The patient did not have any intracranial problems or intrathecal or spinal problems, but the patient had a baclofen pump placed in the left lower abdomen. So first I want to make sure that the patient is not having any type of bleeding. The airway is secured. Bleeding is not happening in circulation. The breathing was good. The blood pressure was almost normal. Heart rate was almost normal. Saturation was fine. She was on nasal cannula at 2 liters baseline. But she was disoriented. She was baseline oriented times 3. She had periods of confusion this morning. She dropped down to oriented times 1. She only knew herself. She did not know the date. She kept thinking I was saying, hey, what's your birthday? But I really was saying, like, what's today's date? And she did not know where she was at. So pupils was fine. On exam, smile was equal, no droop. Tongue was midline, no deviation. Uvula was fine. Also, no drift when you hold arms up. But I wasn't concerned of any of these things anyway because the patient didn't have any cranial symptoms. Only if the patient would have had like a stroke or something like that, I would have been concerned. But she didn't have any type of blown pupil. She didn't have any type of drifts or any type of deviations, droops on the left side. Her left and right side was pretty equal for its strength. So next thing, what was her labs looking like? Come to find out, her potassium was 7, but I had it redrawn when I was at the other hospital because I did check the labs over there while I was in transport to here. But I redrew it. It was 6.8. So then at that point, I was like, what do we should we do? We're gonna give her some dextrose, some, and she also had an AKI. So then we're giving her some fluids. So maybe that could cause a confusion, especially like in an 80-something-year-old patient. Any type of electrolyte imbalances, abnormalities can cause these sudden periods of confusion when you have an elderly person. It doesn't take much for an elderly person. My UTI versus a 90-year-old UTI can be severely dramatic for an elderly person. You can see delirium. You can see electrolyte imbalances or whatnot. Some medications too can cause these, especially a lot of heart medications can cause increased potassium or decreased potassium. So you have these potassium sparing drugs. Then you have these loop diuretics that cause decreased potassium levels that usually need to be supplemented with some type of potassium medication. So These all happen when you have people that have like heart failure or renal disease, which renal, kidney, they all balance the blood, the electrolytes in the blood. Anyway, y'all, so by the time I'm telling them to get stat CBC, I didn't want to repeat the BMP because we had just got our BMP at 7 o'clock. I don't think much had changed since then. Didn't really want to do a stat CT head because she didn't really have any type of neuro defect, so I don't want to waste resources like that. One thing I was kind of debating about was, should we get an EEG? This is a brain rhythm to see like if she was having some abnormalities with seizures or anything like that. But I really wasn't concerned about that. So within like 5 to 10 minutes, she became back oriented ×3. That's the only thing I was worried about with seizures. She was having some right hand twitching a little bit, but she did have problems of spasms. So that's why she was here to get a baclofen pump change. So that could be more like related to her muscle problems versus seizures. Yeah, so we'll recheck the labs in 4 hours, and I'm going to admit her to medicine because, baby, this is way out of neurosurgical hands. And that's another thing, like getting the patient to the right service to get the right treatment, because just because people are providers and doctors does not mean they have a general, like, specific education on certain topics. Like, I'm in neurosurgery. Do not expect me to know everything about cardiovascular. I know baseline stuff. Get an EKG, get a trope, blah, blah, blah. You know, blah. Okay, if it get any more deeper than that, yeah, I'm transferring you to cardio surgery or cardio service. So I think that'll be the best for her. If y'all have any tips on rapid response, are you rapid response providers? Are you a rapid response nurse? Let me know, because it's very crucial that we share information. Sometimes people be trying to gatekeep stuff, and then like when you start a new career, you start a new job, you really don't know what's going on, and it take a lot of time to educate yourself. But if people share things with you and like involve you in this, you can learn faster, make you a nurse, a better provider, a better doctor. Anyway, y'all have a good Saturday. I hope everybody is doing well, learning, making money, vacationing, whatever you want to do today, baby, do it, okay? Peace out.